Alright, so today we will discuss what type of the heart conditions produces what type of murmurs, and how the murmurs are produced. We know that we are very aware of the basic pathophysiology, how the murmurs are produced. Basically, they are produced whenever there is a turbulent flow to the blood. So before we go into the details, let me simplify the heart anatomy here. So this is the right atrium, this is the right ventricle that is separated by the tricuspid valve here, and the left side of the heart that contains the left atrium and the left ventricle, and this is the mitral valve here, right? That is separating basically the left atrium and the left ventricle, not separating, but blood flows through this valve here and this valve here, the tricuspid here and the mitral here. All right, so the from the body, the deoxygenated blood is carried and it is thrown into the right atrium via superior vena cava and inferior vena cava. We are very aware of this. So from the right atrium, the blood goes via this tricuspid valve into the right ventricle. From the right ventricle, we have here the pulmonic valve, and it goes into the pulmonary trunks to the lungs, where it is oxygenated. After oxygenation, the blood is taken from the lungs via the pulmonary veins, and then it is thrown into the left atrium, right? From the left atrium, it passes through the mitral valve and it goes into the left ventricle. From the left ventricle, this is the aortic valve here that throws the blood into body again, the oxygenated blood. Here we have deoxygenated and here we have oxygenated blood. Fine. Okay, so basically all the murmurs that are produced are related to these four valves. This is tricuspid valve, pulmonic valve, mitral valve and aortic valve. Alright, so now I will discuss what type of murmur is produced when. So we basically have four valves here. Alright, so the pathophysiology or whatever the causes of these murmurs produced because of the disease of these valves could be just two mainly. Either the valve can be stenosed due to any cause, causing the stenosis and difficulty of the passage of the blood across this valve, or either this valve can cause regurgitant flow, like not very good opening or the loosening of the valve, causing the valves to have a back pressure, causing the blood to go backwards, right? Like we are required to flow the blood from the left atrium to the left ventricle, but when the left ventricle will contract, we don't want the blood to go back to the left atrium. We want the blood to go back, go via the aorta to whole of the body, right? We don't want it back. If the blood goes back into the left atrium, then we call this flow regurgitant flow, right? But if the patient has a difficulty flowing the blood from the left atrium to the left ventricle because the valve is stenosed, then we call the there is a stenosis of the valve, right? Okay, so now first we will discuss what happens when the mitral valve is stenosed. When the mitral valve is stenosed, then there will be a turbulent flow from the left atrium to the left ventricle, right? So in what phase of the heart cycle will this thing occur? So whenever the diastole occur, the left ventricle relax and causes the blood to flow from the left atrium to the left ventricle, right? So if this valve is stenosed, then there will be a difficulty flowing the blood from the left atrium to the left ventricle. It will pass with very difficulty, right? When this will pass very difficulty, it will produce a murmur, right? So in mitral stenosis, we will have a murmuring diastole phase, right? So always the mitral stenosis, murmur of the mitral stenosis is diastolic murmur. Same is the case with this thing, the tricuspid. The tricuspid stenosis will also cause what type of murmur? Because the flow from the right atrium to the right ventricle will be blocked, so it will also be a diastolic murmur. So apart from this, if there is a regurgitant flow, right, the blood is flowing backwards into the left atrium. So when the left ventricle will contract, some of the blood will go into the aorta, right? But because of weakening or any issue like mitral valve prolapse or whatever thing, if the blood goes backward into the left atrium, it will cause what? Also murmur will be heard. So the murmurs of mitral regurgitations are usually what? Mitral regurgitation murmurs are systolic murmurs. Why? Because it occurs in systole. When the left ventricle contracts, the blood flowing in the aorta as well as it is also flowing backwards. So the mitral regurgitation, the murmurs of the mitral regurgitation are usually systolic. Same is the case with the tricuspid regurgitation. It's a very common condition. If the tricuspid valve causes the blood to flow backwards into the right atrium, it will produce a murmur. So tricuspid regurgitation murmur are also systolic. So now we are left with the two valves, right? So as the mitral and tricuspid valves are similar, the aortic and pulmonic valves are similar as well. So if there is a stenosis, there will be a difficulty in flowing of the blood from the left ventricle into the aorta, right? So in the stenosis of the aortic valve, right, we will have difficulty passing of the blood. So these murmurs, the murmurs of the aortic stenosis, are systolic, right? And if this valve is incompetent, when the heart will contract and will relax again, the backflow will occur again. So the regurgitation of the aortic regurgitation murmurs are diastolic, mainly early diastolic murmurs. Same is the case with the pulmonic valve. If the pulmonary valve is stenosed, there will be difficulty in flowing the blood, so the murmur will be systolic. Pulmonary stenosis murmur will be systolic, and the pulmonary regurgitation murmur will be diastolic, because when the ventricle will relax, it will cause the blood to flow backward because of the incompetency of this valve. So the pulmonary regurgitation murmur will also be early diastolic, right? Thank you.